Hello, hello. How is everyone? Oh my gosh, there's loads of you. I'm sorry. I've had a crazy day, crazy time, crazy kids, so I'm a bit late. I'm so glad you're here. So I just want to check something. So it is good to see you. Um, Good to see you, Mastermind. And good to see you, Rayanne. It's always good to see regular people back. I'm so glad you guys are still chatting to each other. That's really sweet. Um, do you guys have questions? Or you didn't prepare? Come on, keep up. You got to do some prep. Every question is a good question. I want to hear the questions, man. I want to hear the questions. I'm also experimenting. I'm just going to let you guys know I'm experimenting with putting this on Instagram because I did try to do it before and it worked. But with the streaming software I use, it doesn't show me the Instagram comments. So I may just flick over to Instagram to see if I can see the comments, but I'm not sure if it's going to work. But I don't know if it worked. Okay. I'm here. Can you hear me now, Beer Milkshake? You know what? I've only just realized your name, Beer Milkshake. That sounds absolutely revolting. Don't drink that. Hello, Trevor. Good to see you. Hello, Invisible Borderline. What did you think of the jealousy cure? And how are you finding the emotionally abusive relationship? Hello, Sarah. Good to see you. Our interview's nearly ready, by the way. It's such a long one. It took ages to try and process the file, and I needed to play with the audio a little bit. So we sound better than me and Jacob, and I'm really sorry, Jacob. I can see you there, but my audio editing skills have come along in the year since we did our interview. And hello, Jacob. Good to see you. I hope you're well too. I'm not sure what do you mean, how do I deal with people who talk to imaginary people? I mean, it kind of depends, right? I mean, do we all have imaginary conversations with people in our heads? Or maybe it's just me, but that's pretty normal. Um, but if it's kind of someone who's hearing voices and it's distressing and it's a symptom of possible psychosis, then maybe that would be something to think about making a psychiatry referral for. Ah, so there is a difference in video quality. That's a shame. That's a shame. That's annoying. Okay. I'll see how it goes, and then I might just switch off Instagram. I love my Instagram people too. I just wish I could do both at once. That's what I'd like. That's what I'd like to be able to do. I'm gonna see if I can see the comments on Instagram because last time I couldn't, and I didn't see them until I'd finished. And then when I finished, unfortunately, it didn't I couldn't respond to people, which was kind of annoying. It's quite frustrating. So you liked it's a great book. I really like that one. It's really, really useful. It's just a really nice, kind of warm it's a really good book. I like Robert Lee. I like all of his books are really great, actually. So who else is here? So you guys hit me up. Hit me up with questions. So Jacob, weird question. Does childhood trauma block out good memories too? Um, Kind of depends. I mean, I think if you've had so many difficult, painful experiences, it colors what you attune to, it colors what you look for, it colors the kind of way you see the world, so that it may be much harder for you to let the good stuff in. So if you think, for example, everyone's out to get you, then you may not attend to situations in which people treat you well or people are loyal to you, but you're going to be much more hyper attuned to any experiences of betrayal or people deliberately setting out to hurt you. I am struck. I can't see the Instagrams comments. This is frustrating. It's like, I'm really sorry, guys. I don't want to interrupt the screen. I'm just oh, so frustrated. I'm trying to kind of see Instagram too. I might just have to abandon my Instagram, people. I'm so sorry. It's now asking me to verify my account so I can see the comments on Instagram. Yes, it's me. So now it's going to give me that's so frustrating. I'm sorry. Sarah, what was the question? What was the question someone left me on Instagram? Hello, Blob. It's really nice to see you. Does mental illness cause abuse? Or is abuse a separate issue and a choice? It's really difficult to answer that question. The factors that might contribute to someone behaving in an abusive way to other people are really complicated. So, mental illness can certainly be part of that. So, for example, if someone was psychotic and very paranoid, they might attack someone as a result of that paranoia. So that would be really a direct consequence of mental illness. Lots of mental illness will color people's emotional states. It may make them less tolerant. It may make them more irritable, for example. So those factors can contribute to abuse, but they're unlikely to be the only factors that would contribute to abuse. And often there is very much a choice involved, a decision to be abusive. And that can also be colored by personality factors, skills and experiences, external stressors. So I don't think there's a straightforward answer. And of course, another major factor affecting a lot of abusive behavior is substance abuse. So someone's much more likely to be abusive if they're drunk or they're under the influence of certain drugs. So I don't think there's a simple question, a sort of simple answer to, like, does mental illness cause abuse or is abuse just a choice? I think it's probably more complicated, but I don't generally think mental illness is an excuse for abuse. Most of the time, for example, if someone commits an act of violence, despite being mentally ill, that won't be considered sufficient to diminish their responsibility for the crime they have committed. Sometimes it is. So, for example, in cases of severe psychosis, it might diminish their responsibility, because if they committed an act of violence because they were experiencing paranoid delusions, or they were hearing command hallucinations, and they thought that if they didn't commit that act of violence, something terrible would happen, that would be seen differently. And that would be considered as something that would reduce the responsibility they have for the action that they committed. So it's kind of messy, and I think you kind of have to look at it on a case by case basis. But certainly, I think most of the time, mental illness is not the primary driver of abusive behavior. And certainly, if someone's saying, "Well, I couldn't help myself because I'm depressed," or "I can't help myself because I have a personality disorder," those are things that I think are no, that is using it as an excuse. And I think there are things. I mean, it may be different, it may be more challenging for some people to maintain control of their behaviors and to engage constructively in relationships. But that certainly doesn't mean that they have no responsibility and they can't help themselves. And it also certainly doesn't mean that that behavior should be accepted or tolerated, you have to keep yourself safe. Does that answer your question, Sammy? And lovely to meet you. I don't think you've seen. Did you come over from Instagram? Guys, if you're watching me on Instagram, come over to YouTube because it's way better for the comments. I can see the comments. So I don't know that Instagram might not like me saying that, but I'm going to say it anyway. Come over to YouTube. YouTube is way better than Instagram. I'm going to get banned from Instagram now, aren't I? Okay, never mind. It was worth it. Have you heard of the ideal parent figure protocol? Is to treat attachment disturbances, among other things. I haven't. Should I have? Let me know if let me know a bit more what it is, because it may be a lot of therapies have different things or different names for very similar things. So I'd be interested to know what it is, because I'm kind of curious if it's similar to some imagery work that is often done in compassion-focused therapy, for example. So Sarah, how do you distinguish between grandiosity and just really liking yourself? Well, I think grandiosity isn't necessarily a bad thing. So it's really interesting. I'm making a video at the moment, which is a reaction to another creator on YouTube who's a musician who was accused of being a narcissist in the comment section, and she made a video about it. And so I've been watching that, and I messaged her and said, could I make a reaction video to this? And she was like, of course you can. But it was kind of interesting. So I've been kind of reading up a little bit about grandiosity and musicians and performers. And there's a kind of concept called adaptive grandiosity, which is kind of the idea that in order to do something great, in order to be creative, in order to put something out in the world, like being a musician, to perform, to act, to be in a play, to write a movie, to write a script, to write a novel, to write a book, to make a YouTube channel, to put something out in the world, you have to have a conviction that you are capable of something special, something great, something important, something that is worth watching or reading or listening to. So there is a grandiosity inherent in that. And I think where I would see the difference is in, are you able to enjoy that and use that as motivation that keeps you going, that sustains you, that gives you a sense of agency in order to act, without it going to your head to the point where you're completely blinkered. And I think it's maybe the difference between having rose-tinted glasses and seeing the good in yourself and seeing the good in your achievements and your abilities, and being completely oblivious to any faults that you might have, or being unable to take on board constructive criticism or to deal with setbacks. I mean, because true that kind of pathological grandiosity is actually, people who are really pathologically grandiose don't tend to like themselves all that much. In fact, they're incredibly vulnerable to any criticism, and the grandiosity is a defense against feeling pretty crappy about themselves. And so they're very prickly in response to criticism or any kind of negativity, rather than in the sort of more adaptive grandiosity where actually you can take criticism on the chin and still pursue your goals. Does that answer your question? Be kind of curious. I'd be curious as well to hear your thoughts about that, Sarah, what you think. Oh my gosh, online dating. I met my partner online dating, and we have been together for 8.5 years. So it can work. So what you perceive as deception on the part of other people is overwhelming. My perception is colored by my last relationship, or maybe not, to trust or not. What's the deceptions that you're seeing? Like, I remember meeting someone who claimed to be 6 foot and being, hi, nice to meet you. He was not 6 foot. He was shorter than me. I am nowhere near 6 foot tall. I am very average in height. Um, I would think more about, everyone when they're in the dating world is putting the best version of themselves forward. That's what people do. And I wouldn't necessarily see a little exaggeration in height, for example, as necessarily a red flag. Although I would certainly clock it as a interesting. Why'd you lie about that? Um, but I'd look more to like a pattern over time and how they act over time and how they treat you over time and see kind of what comes up. But trust, I think, needs to be earned. So I wouldn't trust anyone on a first date, if that makes sense. I wouldn't distrust them either, but it's kind of more like mind open, but not so open that your brains fall out? And good luck with the dating. I want to hear how it goes. Sarah, how can you distinguish between the real and false self? How do you know is you're functioning from the false self? Oh gosh. Is it possible you might be overthinking it? I think we overthink things a lot. Um, I think I'm not sure that you can, because I think we can all be a little blinkered and we can all be a little fake on occasion. We can all kind of put ourselves together in order to put the best versions of ourselves forward in certain situation. So, you know, uh, how easy is that to distinguish? I think also I'd look for, is there a real difference between how you feel in the kind of public arena compared to how you feel behind closed doors? I think that's probably what I'd look at. I'd be curious at anyone else's views on that. So Christina, good to see you. What's your thought on TFP? You mean transference focused psychotherapy? It's it's not a therapy I'm trained in, but it's a really good therapy for personality disorders, and a lot of people get on really well with it. So those would be my thoughts on it, but it's not one I'm trained in. So the mastermind. So boredom and ADHD is likely caused from low dopamine levels. Do you think that it could be the same with NPT as well? I think it could be, yeah. I can't say that for sure, but I think that's certainly a possibility. And I know quite a few people on the narcissistic spectrum who also have ADHD. So that's kind of I think that is a sort of interesting thing. So, obviously it is possible to have both narcissistic personality disorder or narcissistic traits and ADHD. And I do wonder if there may be a degree to which they go together because they're both associated with impulsivity, a tendency towards boredom, difficulties in sticking with things. So it would certainly be interesting to think, maybe is there some sort of link there? So, Rayan, as a continuation of Sarah's question, let's assume one suffers from NPD, adapt their behavior to get external validation. Is it possible to forget your real self? I don't. I always struggle a bit with this sort of like idea of false self and real self. It's just not a way. I don't think about these things in such black and white terms. Um, I kind of think we all have different modes, and like we all, on occasion, hopefully, on occasion, have a bit of a grandiose mode. We all do things that are maybe, we put ourselves forward, we let ourselves shine, we put ourselves out in the world, and we do things that are hopefully pretty special. But I also think there'll be other times when we're in different modes. There'll be times when we all feel a bit more vulnerable. There'll be times when maybe we all get a little angry. There'll be times when we all feel a bit deflated. Um, you know, there's a whole range of human experiences. So I'm not sure it's so helpful to think along the lines of false self and real self. And I'm more interested sometimes in what are the parts of us that we tend to overemphasize and what are the parts of us that we tend to neglect. So, Christina, you're getting help for your MPT, but not seeing much improvements. I'm glad you're getting help, but it is, um, it's a long road. So, be patient with yourself and give yourself time. That you're getting help at all is great, great start. And I really hope it's effective. I hope it does help you. Hi, Olivia, and it's good to meet you too. I am just like I was saying earlier about this idea of how do you recognize the false self? How do I check for myself if I do function from the place of the false self? I don't think it's black and white. I don't think there's a sort of real self, false self. I would be asking much more, what are you overemphasizing and what aspects of yourself may you be neglecting? That I think would probably be a more helpful question. And I also think it isn't very helpful to take the stance of constantly questioning yourself and doubting yourself and analyzing yourself and kind of almost becoming a little obsessive and overthinking and ruminating about your behavior and what drives it. I kind of think there's a sort of healthy level of being unself-conscious that you just exist in the world, relax. Relax. And let me know, does that answer your question? I'm not sure if it does or not, but let me know what you think. Um, so Trevor, healthy grandiosity question mark. Yes. Yes. You know, some would say some would say I have unhealthy grandiosity. Um, you know, would I be here giving a live on YouTube if I didn't think I had something valuable or special to offer the world, right? Is that healthy grandiosity, right? It's the idea that you do something creative to put yourself out and you believe yourself capable of something special and you follow that. And when you do that, that's healthy. That's creative. Where would humanity be without a little grandiosity? So blob, isn't it too bad that the only answer when dealing with an MPD relationship ending is to go no contact? I understand that someone unaware won't try to heal themselves. It's also it's also not realistic. It's really not realistic at all. Because the reality is that for some people, when you leave a relationship that's really not been working for you, um, they have no ties. They have no children. They don't have shared financial ties. They have nothing to sort out. In many ways, I would ask, why would you be in contact with someone? What would the purpose of that contact be? And then there are other times when actually you end a relationship, but you still have children and you're still going to have to make arrangements as parents. This person's going to be in your life for the rest of your life in some way, shape, or form, even if you would prefer they wouldn't. And also, I think sometimes the person who's narcissistic that you're in a relationship with may not be someone you want to just cut out of your life. It could be a parent, it could be a sibling, it could be a friend, it could be a coworker, it could be your boss. Um, and some people may decide to go no contact with a parent or another family member, and that is their decision to make, and sometimes that's necessary, particularly where there's been abuse and the person is really dangerous to be around. But very often, people do want to remain in some form of constructive relationship with someone who has NPD or highly narcissistic traits. And just because someone has NPD doesn't mean that they have no relationships of any value. Okay, they may have tricky relationships, they may have challenging relationships, there may be difficulties in them, but that doesn't mean they're not worthwhile and valuable in some way. And I know now I'm going to be accused. And when I say things like this, I get accused of saying, oh, now you're just justifying abuse. Now you're just telling people to stay in abusive relationships. And I'm like, you have no idea how many people I have helped end abusive relationships and not be in contact with their ex. I do that all the time. But it's often more complicated than that, right? So, yeah, I think it's a real shame. And I also think, of course, then I think you also make another important point here, Bob, is that to what extent is the person with NPD taking responsibility for themselves? Are they acting in a consistently abusive and horrible way? In which case, why would you want to be in contact with this person? Or are they Are they trying? Are they messing things up on occasion, but in other times they're actually, good to be around and willing to be accommodating of you, willing to at least try to understand where you're coming from. So I don't think it's black and white. I really don't. And I think it's a real shame that people kind of have this view of narcissist means no contact, narcissist means toxic person that you shouldn't have in your life. I think you're right. It's a real shame. And it's one of the reasons I started making content, because I'm grandiose enough to think that I have some ideas about this that may be useful to other people. And, I reached 5,000 subscribers this week. So 5,000 of you can't be wrong. So, Rayan, Dr. Ruth, what about making reaction videos on content of anti-narc videos? I'm experimenting with a reaction video, but it's a video that I like and it's a creator that I like. So I'm not going to, but that's my experiment. That's my version of dipping the toe in the water. So send me a video you want me to react to and I will consider it. I will consider it. We could have a watch party because we can watch them together. Ooh. Now there's a thought. We could do a Sunday night reaction to an anti-narc video. You guys message me, leave a comment in the community. What video could we react to? Olivia, thank you for doing it. Guys, if you are on Instagram, I can't see your comments. So as much as Instagram may hate me for doing this, and maybe I'm going to get banned from Instagram for doing it, pop onto YouTube Live and leave your comment there. I don't know if Instagram have already kicked me off the live. I'm going to have a quick look over on Instagram to see what's going on. If anything's going on. I think they may already have kicked me off. I don't think I'm live on Instagram. Probably because I said the word YouTube. Oh my gosh. So the mastermind, if you can add on to Sarah and Rayan with a super dumbed down question, ask how you even find your real self. I'm worried this is ruminative. I'm worried this is like, yeah, I'm not sure. Like, is there a real self? We all have different parts of us. Thank you, Sarah. You see, a narcissist can be considerate and helpful. You didn't hear the whole answer. You got to rewind and watch it again. I love Mark Eatonshire. I'm just going to say that. I really like him. I think he makes great content. I'm jealous of his very calm style. I'm like, wow, just so relaxed. So invisible borderline, lies about small things, using old photos that don't even look like them anymore, things like that. After my last relationship, I'm very sensitive to lies. Yeah, you know what? I would pay attention. I wouldn't necessarily rule someone out just because I didn't like their photo, or just because their photo was a little old. But I would certainly pay attention to it. And I'd certainly also pay attention to blatant lies, even about small things. I remember an internet date that I went on, and the guy started the date. And at the start of the date, I can't remember the exact age, but his profile had said he was 37 or 38, something like that. And then he told me actually he had turned 40 and he didn't want to put it on his profile because he worked in performing arts and that would count against him. And he just wanted to be upfront about that. And I clocked that as I'm not sure I like that, but okay. But then he later on said actually he was a little older than 40 and he was very sensitive about his age and he thought I would be understanding. And at that point I was like, yeah, but you know what? That's actually, now you've told me you lied to me about your age. Then you lied to me about your age again. And now apparently I should believe you now. And this went on. And I'm like, you know what? Let's go. I'm done. And it turned out we were on the same tube on the way home. We're literally sitting there in the tube, at which point he says to me, "I liked you. Could I come back to your place?" And I was like, "No." And he was like, "Why not?" And I said, "Because at the start of the state, you were 38. In the middle of the state, were you 40, and now you're 42 or 43. If I let you come home with me, I'm gonna wake up with a pensioner tomorrow morning, and I am just not into that. So go home." I enjoyed that date. But yeah, I would pay attention to little lies. And you know what? If for you that's your trust your instinct as well. I think if those little lies are triggering for you and integrity and honesty is really important for you, there's plenty more people for you to date, you know. Ah, Mark. I hope it goes well, Sarah. This question came from my OCD. Of course. I must have been overthinking it. This is a thing. There's so much overthinking. Beer milkshake. The ideal parent figure protocol is pretty new. It was created by Daniel Brown, who was a meditation teacher and professor of psychology at Harvard. I will check it out. I will check it out. I think it may have parallels. I'm curious about what it is because there may be parallels in other therapy. So in compassion focused therapy, we often get people to kind of imagine like an ideal compassionate image or figure. And in schema therapy, we'll often get people to imagine their healthy adult, the good parent mode. So we kind of have things like that. So I'd be kind of curious as to are there some parallels, but I'm definitely going to look it up because the nice thing about being a therapist is that we do kind of poach from other models and just integrate them into the work we do. So if it's good, I might well find myself using aspects of it. I will definitely look it up. Well, I have both, so let's ADHD and NPD. This is I know so many people with both. You have a fake self and the inner voided self. I'm curious as to what the difference is, Sarah. That's interesting. Beer milkshake. Sorry to put you on the spot, but what are your thoughts on Sam Vaknin? You're putting me on the spot here, man. I'm not a fan of Sam Vaknin. He doesn't he isn't a clinician. He I don't even think he has a psychology degree. He isn't recognized as an expert in narcissism within the field of psychologists. Um, he had a big spat with Craig Malkin on Twitter about it. He writes descriptively about some things, but I really think that Vaknin's work has created a lot of moral panic around narcissism. I mean, he really his work has been the source of a lot of ideas about narcissism and a lot of pop psychology ideas about narcissism and kind of language like no contact and discard. It's very black and white. So he's not to me, he's not a source that I would go to. Let's put it that way. But I think he does describe certain relationship dynamics and personality styles in a way that I think some people do relate to. But yeah, that's my view on Sam Vaknin. So the mastermind, it's the same for me, but he tends to change this about himself too much. Do you mean Sam Vaknin? So I see me. Hello, I see me. Like oh, nice name. My narcissistic husband calls people out on their critical and meanness and perfectionism. I tell him he does it to me. He agrees. He says he's trying not to. What does that say about him? It may say he has some insight that I don't know what it says about him. You know him. You know him. What do you think it says about him? And how does that, do you see him trying? And how would he respond if you were to say to him in a gentle, constructive way, Ooh, I feel you're being a bit critical of me. Like, ouch, that hurts. Is he able to respond to that with a degree of concern for you? Um, that would be the question I would ask. Oh, I'm not gonna I'm not gonna say because if we've spoken one to one, I'm not gonna discuss anything we've talked about on a YouTube video in public. But you're welcome to get in touch again, Olivia. I'm just remembering now. Do you have any advice on how to work with impulse control and irritability? When I don't take my ADHD medication, I really struggle. Take your ADHD medication. If you have ADHD, the medication can really help with impulse control and irritability, and it can keep things going well. Um, So definitely that. And I think also, realizing when you're taxed, realizing when your system is taxed and making sure you give yourself a bit of a break. And also even just being able to say, I'm tired today, so I'm more irritable. I'm more likely to overreact. And using that as a way to put a stop in with yourself before you say something to someone that you might later regret. I know when my daughter was really young, and we were really sleep deprived, my partner and I used to say to each other, we wouldn't be feeling this pissed off if we weren't so exhausted. And that's a really helpful thing to say, because you're not denying that you're really, really pissed off, but at the same time, you're realizing this is not just about the other person here. It's about my degree of irritability. So that, let me know if that helps. You're right. Absolutely. It's not black and white. Sometimes I feel like the literature and say more, Trevor. So I am still live on Instagram, but I can't see it on my Instagram account. Let me check. And guys, if you're on Instagram, I may not be able to see your comments. Just so you know. And if you are on Instagram, come onto YouTube. Yeah, I'll see your comments on YouTube. So I am still live on Instagram, but I can't see it. That is so strange. Yeah, but I want to have another look. I can't see me being live on Instagram. That is so weird. Okay. Oh, well, never mind. Hello to everyone on Instagram. Sarah, all my first online dates are video dates. I refuse to get catfishes. Good idea. When I was online dating, I used to insist on having a phone call because video calls were not really a thing back then. But I would insist on having a phone call, mostly because I could weed out any real weirdos. And I remember one person just talked at me and he just kept talking at me. And I was like, I don't want to meet you. He's like, why not? I said, because you've just talked at me for an hour. Bye. So I think some form of contact where you actually get to speak to the person and ideally see them before you make the effort of going out on a date is probably a really good thing to do. So 10 out of 10, I endorse Sarah's dating strategy. So Sam, or Olivia, Sam Vaknin. Sorry, Olivia. You're not Sam Vaknin. I shouldn't be calling you Sam. Olivia, Sam Vaknin claims that having NPD means there is no one home, like the person didn't exist. I think that is extremely harmful to say such a thing. I would agree. I would agree. And Trevor, in answer to your question, yes, I do think the diagnostic labels can do more harm than good, especially when they're used primarily as insults rather than as a means of understanding people. I rarely actually will say to someone, I think you have a personality disorder, because what does it doesn't really say that much. I'm much more interested in How do I help this person make sense of their experiences? How do I help them to make sense of their relationships and the patterns that they're in and the effect that their experiences have having on them and how they color the way they see the world? That's the question I'm much, much more interested in asking, rather than slapping a label on someone. Now, where diagnoses of personality disorders I think can be helpful is in giving you a direction in terms of treatment. So if I know, for example, that someone's grandiosity stems more from a narcissistic personality presentation than from, say, an episode of psychosis or mania, that's really helpful to know because if I think it's stemming from psychosis or mania, then I'm going to suggest that they see a psychiatrist ASAP and that they consider medication to treat those conditions because those conditions are not really treatable with psychological therapies. Psychological therapies might help, but the main treatment would be medication. So that's where the diagnoses are helpful. But I think when you go around calling people narcissists, I don't think that's helpful at all. And I think when the label is so stigmatized and there's a lot of beliefs about, say, narcissism that are just not correct, okay, I think then when you give someone that diagnosis, you have to give it with a load of caveats. I mean, if anyone asks me, do you think I have narcissistic personality disorder? And I have to say, that I think they may have traits or I think they may be in that ballpark, I will explicitly say, but I don't want you to go reading social media content about this because I don't think that social media content is likely to be helpful to you. And I will specifically name people I do not want them to watch. And I will also suggest if you are going to look up information about narcissistic personality disorder, may I suggest myself, Wendy Behary, Mark Eatonson, Eric Perry. Those are the people I suggest. And I'll also suggest people like Sarah and Jacob who are making content about their own experiences because I think it can be very helpful for people to see their own experiences mirrored to them. But there's such a mess. The internet is such a mess with really stigmatizing content about narcissistic personality disorder. So, Blob, no dating sites. Go out and meet people face to face. You know, I agree, but sometimes it's hard to meet enough people face to face. Because I know when I was single and dating, I worked in a psychology department and I was not about to date any of my colleagues. No offense. I don't date workmates. I don't date people I work with. That way lies not good things. So, and my friends were mostly female. And I liked doing yoga. That's what I did. I did lots of yoga. So this is not a good way to meet men, If my male friends ask me, how can I meet women? I will say, take up yoga because lots of single women there. So I just found dating sites were a helpful way to be introduced to single men. And that's all they were good for. But there's a lot of weeding out. And I think you have to quickly meet someone face to face and come to a conclusion about whether it's someone that you might want to develop some sort of friendship with. But even then, I think it's really difficult because you're meeting lots of people and it's so artificial because you're kind of meeting them and making a judgment, and they're making a judgment about you very, very quickly about whether or not they may want to pursue some kind of relationship with you. So I think that's difficult. But I also think it is how a lot of people meet. So let me know, how do you guys meet people if not online dating? So Olivia, is it easy for you to recognize a person with NPD? Does it usually happen during a first session? I wouldn't say it's easy or difficult. I think it depends. I do think you can have a gut reaction to someone. When you meet someone, you have that gut reaction, you kind of know something about their personality style. I do know what different personality styles bring out in me. And I think, while I wouldn't use that as a diagnostic assessment tool, I certainly think it's worth paying some attention to. I wouldn't say it usually happened in a first session. You have to get to know someone, and I think as well, to make a diagnosis, you have to rule out other things. You have to be thinking about more broadly about someone's mental health and how they're presenting. So I wouldn't say it was easier, but at the same time, I do think you can have a gut reaction that gives you a bit of a clue. But I also think, someone can present in ways and they don't necessarily show the narcissistic aspects of the presentation. So it's hard. But then again, I think because I specialize in narcissism and because many of my referrals now come from social media directly to me, of people who are specifically looking at content and narcissism, I think people are much more directly coming and saying, I think I have narcissistic tendencies, or I think my partner has narcissistic tendencies. So that sort of colors things. So I'm not really answering your question. It's a difficult question to answer, and I think it's complex, and it depends. So when you thought you were a narcissist, you watched Sam Vaknin, and it would put me in panic. You don't watch Sam Vaknin. Not if you think. Not if you think you're a narcissist. Cluster B milkshake. The fake self is who I want others to see, and the inner void is nothing there. Yeah, I can be entertaining and funny and talk about experiences, but I feel nothing real, I guess. Yeah, I can see that. And I think sometimes I would think about that in terms of schema modes, that you may have a mode that can be the entertainer. You can put on the happy face, you can be entertaining, you can be funny, you can talk about things, be quite charming and sociable, but inside feel that that's quite shallow and not very real. And then but you can also have that real sense of being cut off and disconnected, which may be a different mode. So yeah, to me, it makes sense. Let me know if what I said makes sense. So I'm just looking at the comments. You see what I did? What did I do? You're welcome. I think you think Sam could use some compassion in his life. And questions about IPFs, this is ideal parent therapy. There's a lot of crossover schema and compassion-based therapy. Absolutely. And there always is. And what is the most effective therapy for NPD? There isn't a most effective therapy for NPD. We don't have any data on that at all. And I think it kind of depends on someone's particular goals for therapy. So, same with borderline. If someone has borderline personality disorder and they're really struggling with self-harm and they're really struggling with impulse control and their emotions are really, really dysregulated, something like DBT is probably a great place to start. But if they're struggling much more with their interpersonal relationships, with intense interpersonal relationships, with how they feel about themselves, and that's what they want to address in therapy, then something like, say, schema therapy or transference focused psychotherapy, or some of the more like psychodynamic therapies, like cognitive analytic therapy, kind of take your pick, right? And I think probably the more important thing is to find a therapist who has experience and is comfortable working with narcissistic presentations. So I would choose the therapist more than the therapy. Let me know if that makes sense. So, like, I'm less worried. I'm less concerned about the model of therapy and more interested in their experience and attitude at working with narcissistic presentations. Olivia, do you think you can treat ADHD effectively with therapy only? I keep feeling like taking stimulants is bad for my health, even though they help me 100%. I barely experience any symptoms when on them. Well, we do have research on this, Olivia, and unfortunately, psychological therapies are not effective at treating ADHD. They're not even close to being as effective as medication. And even combining them with combining medication and therapy when it comes to treating ADHD symptoms, it doesn't really add much. That's not to say therapy isn't useful. Therapy may help with things like procrastination, rejection sensitivity, interpersonal issues, anxiety, self-esteem issues. But for actually managing ADHD, the medication's really, really helpful. Stimulant medication generally isn't bad for your health, okay? Something, there are risks associated with any medication, but stimulant medications are really very safe and they monitor things that are important, like the effect on blood pressure and cardiovascular symptoms. And untreated ADHD is bad for your health. So that's what I think. And I think if they work for you and you barely experience any symptoms then on them, why not? Take what works. Invisible borderline. Yeah, it's finding the right people to meet. So mastermind, you don't like meeting people with dating in mind. I would have to be too open, and if it doesn't work out, then there's another person in the world that knows too much about me. Yeah, I think sometimes those dates can create real artificial intimacy. And then also people hold back, because you never know where it's not a it's quite an artificial way to meet someone. I do have some things that I do think are quite helpful. And one is to, from an early stage, introduce your date to other people and see what they're like in a social context. So you see how they relate to other people, as well as how they relate to you and how they gel with your friends, how you gel with their friends. I think that can be helpful for people who are doing it. But it's not I'm not advising to date. I'm not advising against online dating. So don't do it if you don't want to do it. But good luck to Invisible Borderline. So no comment. No comment. Do I think the narcissistic collapse is a real phenomenon, or is it a kind of term invented by the internet? Oh, I'm not sure. I mean, is it in the psychoanalytic literature? It may be one that comes from the psychoanalytic literature. I'm going to put it this way. It's not a term I've ever used in a clinical setting. So I don't know, is it a term invented by the internet, or does it come from the more psychoanalytic literature, which is not a literature I'm particularly familiar with? I think the way I would see it is that someone who's highly narcissistic has such a need to be seen as special and to be admired that their reaction to failure and defeat can be extreme because it triggers such a deep fear of being inadequate or being rejected or being scorned or being thought of in a negative way or being belittled or humiliated. So that's what I would think when it comes to narcissistic collapse. I think there's a degree of truth in that phenomenon, but I think it's probably better understood as this is a reaction, a narcissistic reaction to an experience of defeat or failure. But let me know other people let me know what you think on that one. Have I seen significant progress in people with MPD that you work with? Some, yes, and some no. It varies. But, I'd also say that it's kind of interesting. If I'm asked, can people with NPD change? Can a narcissistic person change? My answer is it kind of depends on who's asking the question. I don't think you should assume that your highly narcissistic, abusive partner or friend is going to change their behavior for you. That's just not the way the world works. But if you are struggling with your own narcissism and you're saying, can I change? Is there scope for me to grow and develop? Then absolutely the answer would be yes. And the fact that you're answering that question would suggest to me the answer is yes. I'm curious, do you think that's a good answer? So Mac, I was a real mess when I found out about my PD diagnosis. I'm sorry. Long story shortened, it could be bipolar or your personality. That's a terrible way to communicate with someone. You know, I think if you're gonna give someone a personality disorder diagnosis, you have to be give time. One, you have to do a full assessment. You cannot draw that conclusion on the basis of 15 minutes or on the basis of your gut instinct, right? That has got to be on the basis of a comprehensive assessment where you think about other possibilities. And I would also say I would never make a diagnosis of personality disorder in someone who was experiencing an episode of mania, in someone who was severely depressed or was suffering from an anxiety disorder until those things have been treated first. Okay, because someone who's very depressed, someone is not acting in the way they normally would. Okay, so that those are the things. And then I would also be saying, you know, I think personality disorder is a horrible name because it kind of implies something fundamentally something fundamental about your personhood is disordered or wrong, and that's not how I see it. I would see that the a combination of your genetic temperament and your genetic predisposition and the life experiences and circumstances that you've been through color the way you see the world, color the way you see yourself, color the way you react and respond in your relationships, and that those things are causing you problems. It does not mean that you are fundamentally flawed as a human being or that you will always struggle with exactly the same issues in exactly the same way, or that there's no scope for change. Let me know if that makes sense. And I'd be really curious of people how who have diagnosis of personality disorders who found them useful. How would you explain it? How do you think would be actually helpful to explain PD diagnosis? So Olivia, any advice on how to cope with OCD triggers? People told me before that when they first met me, they had a negative gut feeling, and it really triggered my fear of having NPD. Um, I think with OCD, the main treatment is exposure response prevention. So it's figuring out what are the things that you avoid because of the obsession that you have, and then you expose yourself to those things. So if you're kind of OCD centered around things being clean in order to prevent contamination, okay, it's a very common OCD presentation, then I would want you or I would advise you to expose yourself to things that you felt were contaminated in order for you to see that there's no catastrophic outcome from that. If your OCD was centering around checking, then it would be not to check and to expose yourself to not checking or to allowing something to do something wrong. So, for example, if you check all the switches and you always have to make sure they're turned off, see what happens if you leave them all turned on. Because you're exposing yourself to the anxiety of that and seeing that nothing bad is happening. So that's what you would do. Um, so let me know if that's helpful. But I think OCD is really, really treatable, but it's challenging to treat. And I would really suggest if you think you have OCD, that it would be really helpful to see someone who specializes in that. So let me know if that's helpful. And I'm glad you thought it was a good answer. I don't know what you mean by you're bad. You're good, mastermind, you're good. Olivia, do you think ADHD can mimic NPD? Sometimes the behaviors are similar and both use similar coping mechanisms. I think that's possible, yeah, for sure. So, Mac, 4 years later, I was diagnosed with hypothyroidism as well. Oh, which has very similar symptoms to bipolar. This is where I think you have to understand, you have to do a comprehensive assessment and see the whole picture, including physical health. 100%. That's a really, really good example of why slapping one diagnosis in someone just isn't helpful. And you need to kind of see everything. I see me. How do I determine the exact reasons I stay with my narcissistic husband? My lifestyle is one reason, but I know I'm unhappy and I feel I'm not being the wife I should be to him. I love, hate him. I think this is probably something that would be very helpful for you to take some time with maybe a therapist who's experienced in helping people with relationships and really weigh up the pros and cons of staying in this relationship for you. And also be thinking less about blaming yourself for not being the wife you should be, and more about who are you becoming in this relationship? And what would life be like outside of the relationship? What would be the barriers to you leaving and to exploring something new? Um, and is that a possibility you want to entertain? And also be thinking about other things. I think, I'm certainly not suggesting you stay or you leave, okay? But I think it is very helpful if someone feels I can't leave, I'd lose my lifestyle, I'd lose my home. And those are real fears, and they're important to consider. I would also suggest it very helpful for you to have a conversation with a divorce solicitor about what you can realistically expect in a divorce. Divorce is hard. It's not something you can enter into lightly, and there are real consequences to it. But I think finding out all the information and being fully informed as to the situation you're in can be a really helpful thing to help you start imagining what life might be like outside of a marriage. Because I think if you've been married, especially if you've been married for a long time, it can be really hard to just imagine your life with someone else. Like that's hard to do. So I hope that's helpful. Yeah. DSM Queen, you think it's a perfect way of phrasing it. It's the wrong way to start therapy with a narcissist if your goal is for them to change for others. I absolutely agree. So if my OCD is around being a narcissist, what exposure technique can I use? I can't think of one. I can't think of one off the top of my head, but I think if you were with a therapist who was experienced in treating OCD, and I have some experience in treating OCD, I think you might be able to figure some of that out. I don't think it'd be easy, but I think it might be possible. Um, but good OCD treatment is highly, highly individualized. It really involves looking at what are your specific obsessions and what are the specific things that you do what are your specific compulsions and how are they maintaining your obsessions? And what bad thing do you think those compulsions are stopping from happening? So you really need to explore those things in detail. So I can't give you a kind of cookie cutter, this is how you do exposure therapy. And it's hard to think of examples because I think what you're describing as an obsession, the kind of obsession with being a narcissist, which is a presentation I've seen in other people. Oh, I will say that much. And I think I think I'm seeing it because of what I specialize in, because those people seek me out. But I think that is really, really interesting. But I think you need to explore it and you need to really understand yourself individually. And then the exposure strategies will come from that very nuanced individual understanding. So narcissistic collapse is very real to you, unfortunately. Yeah. The most success I've had with reducing my need for narcissistic supply is lots of compassion practice, taking the red pill and facing it. Yeah. Would you say it was as well, beer milkshake, that it is a reaction to a sense of failure or defeat? Is that your experience of it? Olivia, how can we distinguish between needing narcissistic supply and simply chasing dopamine? That's your obsession. Sometimes you have to sit with things not being certain. How can a person work on feelings of superiority? I mean, feeling like you are better than other people in some ways. There's lots of things. I would say, first of all, Olivia, is the sense of I need to not think of myself as better than other people, is that part of an obsession? Um, so there are questions to ask yourself here. But more general advice around feelings of superiority would be actively choosing to be appreciative of people, to see the good in people, to be grateful for what they contribute to your life, and to kind of just erode that hierarchical thinking in a way. That comes with narcissistic presentations. That can be really helpful. I also think it can be really helpful to intentionally do things that you're not so good at, as a way of practicing not being superior and being around people who are better than you and allowing people to be helpful to you, to teach you things, to help you out. So that can be a helpful thing too. Um, but again, I think these are actually really individual things. Invisible borderline. Dr. Ruth is correct. Divorce is hard. It is. And it's hard to start over after a long relationship. 30 years. Wow. That's a long relationship. That must be a big proportion of your life. So that is a big deal, but worthwhile in the end. I'm so glad it's helpful. And I agree. Just talking, you don't have to tell your partner you're talking to an attorney or a solicitor, but it helps give you a perspective and a reality check on what divorce would be like. And that reality check may be painful, it may be surprising, it may be hopeful, but it gives you a real sense of the reality of your situation. I think when you have all the information, that is what puts you in a position to make an informed decision. Years ago, the former head of Scottish mental health welfare position said mental health services like to keep people diagnosed with PDs at arm's length. Unfortunately, that's true. That is true a lot of the time, and I think that is it's been a terrible thing. And I think it's a very stigmatized diagnosis, and I think people are treated very badly. So, Olivia, I'm glad you find it interesting and helpful. I'm glad. Thank you. You imagine I go a bit Fruit Loop after these videos. Maybe I do. You have to ask my partner. Where did my interest in MPD come from? Kind of natural, like it's just I don't know exactly, you know. I've always liked cluster B presentations and it's enjoyable to me. So that's just kind of there. And I also it's hard to know exactly. I do just like working. I do just click with people. I also think I grew up in a very authoritarian environment. I was told what to wear, what to do. I grew up around narcissists, probably not of the malignant variety, but certainly there were narcissistic structures in the institutions that I was around when I was growing up. And part of kind of that meant my growing up, my maturing involved being very independent, learning how to trust my own voice, learning how to be a little bit of a rebel. Like to say I have an inner rebel would be an understatement. Anyone who knows me well has probably seen my rebellious adolescent mode coming out in full force. But I also think that has been very helpful in working with narcissistic presentations because I do not do hierarchical thinking. I find it appalling. I don't see anyone as better than me. I also don't see anyone as inferior to me. I have this very strong sense of everyone is equal. Everyone is of equal worth and value. And so that means I'm not razzle-dazzled very easily. I'm not enamored by someone very easy. And I think that helps me hold my own. And it also helps me not to kind of melt when someone is perhaps looking down on me. So I think that has certainly been something that's helpful. And then I also think my rebel mode, when someone says something is untreatable, my rebel mode and my sense of actually, I think everyone is equal is offended by that and wants to respond to that. So I think that comes into it well. I don't know if I explained that well, but I have this real sense of not giving up on people and not seeing anyone as a write-off. So I have that sort of draw. If you're saying something's untreatable, that's to me, I want to question, I want to ask questions about that. And I mean, I'm also realistic. I think there are certain narcissistic presentations, probably on the more malignant end, the more antisocial and psychopathic, sociopathic presentations that I don't think are necessarily so treatable. But I think there's certainly a huge amount of narcissistic presentations that I think are also part of just being human and seeing them as human issues and things that can be managed and things that can be dealt with and things that can be addressed and that human beings can grow and evolve, I think is something that can be helpful, and something that could be possible. So I don't know if I've explained that well. I may have waffled a bit, but let me know if that's helpful. You don't equate it with failure and defeat because you don't set many goals. What is it for you then? Where do obsessions come from? They often, I think you've answered your own question. Yes, I think they are part of anxiety disorders. So I don't know how to ask this, but is someone with ADHD who's raging out look similar to someone with NPD raging out? It's caused by different things, but would it look the same? So, you know, possibly. Possibly. Like, these are sometimes difficult to kind of pin down, like, what actually is narcissistic rage and how is it different from someone else who's in a rage? Is it different from someone else in a rage? Do you have to be a narcissist to experience narcissistic rage? I don't think you do, by the way. I think any of us, if you perceive enough of a threat to your self-esteem and you really feel someone is insulting you, might respond in a very angry and aggressive way. So maybe that's narcissistic rage. I think whether I think to think about whether it's driven by narcissism, I'd look for the inability to apologize, the inability to acknowledge your role in something, to admit any mistakes or flaws, needing to blame the other person or put them down. Whereas I think someone with ADHD who isn't also having a narcissistic presentation, it's often the rage is much more self-focused. It's a much more anger and frustration at themselves for their own challenges in doing things. So you're 54 years young, so more years married than not. Yeah, so it's more than half your life. You know, you're on a wonderful journey of discovery. Everybody rages sometimes, right? Even me. I think I think it came with I think both. I think it's kind of been there, but it's certainly grown. So Little King, hello. Welcome. As someone diagnosed with MPD, I view my narcissist as demonic for lack of a better word. Have any of your clients ever described this phenomenon? Seeing you view yourself as demonic or view yourself as I'm not sure what you mean, Little King. I think certainly some people do see the narcissistic parts of them as very harmful, and indeed sometimes they are very harmful. Um, do you mean literally you would describe that to sort of spiritual demons? I'm not entirely sure what you mean. So beer milkshake. You associate narcissistic claps strongly with supply because I'm constantly experimenting with trying to get rid of it because I find it harmful and judge myself for wanting it. Yeah. Okay. So it's like it is that sense for you of then judging yourself for what you want and for needing supply. Everybody wonders if their family is a bit odd or fucked up. Yeah, well, some people's are certainly more messed up than others. So who? To answer something from earlier, to me, having BPD is like sitting in the back of a car while your logic and emotions are fighting for the wheel in front and you're just stuck observing the chaos. Wow, that's a great metaphor. I might use that. That is a great metaphor. Great way to describe BPD. I agree. Really. So Trevor, I also have a lot of OCD-like obsessions about being a narcissist. See? Part of your exposure therapy has been learning the narcissist, that evil bad person, doesn't actually exist. Ooh, go say that on a narcissistic abuse channel. Don't do that. Bad advice. Don't do that. That was my rebel speaking. Olivia, do you think starting conflicts almost on purpose and feeling regulated afterwards is something narcissists do? Sometimes. But it's also something other people might do too. I don't think it's inherently narcissistic. I'd look for what is the motivation to start the conflict, and why do you feel regulated afterwards? Is it that you pick a fight in order to get reassurance and to have the makeup time, to have that's a possibility that may not be narcissistically driven. The metaphor about BPD describes your experience of ADHD. Yep. Take the meds, Olivia, take the meds. Guys, it has been a pleasure, but it is also really late. So I am going to wrap up. But as always, it's a joy. And thank you so much for being here. And I will aim to be here next week at the slightly earlier time of 9 p.m. UK time, which is 4 p.m. Eastern. Anywhere else, you got to figure it out for yourself. It's way too late for me to figure out different time zones. But I will see you guys soon. I'm just going to respond to Little King. It helps with schemotherapy when you separate these parts of yourself. So your narcissist I view as a sort of demon that possesses me. Yeah, so it's like a mode, and it's a mode that maybe takes over. But it's also a mode that you're going to need to find your healthy adult, because that mode sounds like it needs some healthy limits and boundaries. But you guys, thank you so much for being here. If you're on Instagram and you left a comment, I'm really, really sorry if I wasn't able to respond. Don't let it put you off. And I will see some of you guys next week. Take good care. See you soon.